name is Sepideh Rousta, and I'm a pediatric eye physician at University Children's Eye Center in East Brunswick and Bridgewater. We are a practice of 3 pediatric eye physicians and 2 pediatric optometrists. We have been in practice for over 27 years. I have been there for 25 years. Pink eye is a very general term. You can think of it best as anything that inflames or sort of irritates the eye. A lot of people think it's something specific, but actually there are many, many subcategories of what it is. The general term is pink eye, meaning your eye is irritated and inflamed, and it does not actually say what the diagnosis is. A lot of people think, okay, pink eye means I'm infected, or pink eye means I have allergies, but those are all subtypes of a very general term called pink eye. Pink eye can affect any of us at any age, but children, especially young children, can be very susceptible to pink eye, namely because a huge category of pink eye is infectious types of pink eye, bacterial or viruses. And as we know, children, while adorable, may not be the most hygienic at times. You know, they're in each other's faces. They may be touching dirty objects or getting sick at school or daycare. So they are very susceptible to pink eye. In addition, some of their immune system is not as strong as an adult. So they are a susceptible population to having different types of pink eye. But as I said, there's other categories of pink eye: allergic, which any of us can get, and then more serious varieties that anybody can get. When children contract pink eye, which is in a subcategory of infectious pink eye, there are 2 large categories: bacterial and viral. Both of them can be easily passed from child to child, or child to parent, child to teacher. The viral kind is particularly highly infectious and can actually cause an epidemic in a school or a daycare. So this is very important for children who may not be able to tell you at the first signs of pink eye, to at least try to isolate them to some degree, have them wash their hands, obviously keep them home from school or daycare if you're not certain what subtype of pink eye you're dealing with. Again, the largest category is infectious, and children may easily spread it from place to place, person to person. Again, it sounds like for pink eye, it's semantics, but people sort of refer to anything that makes their eyes pink or irritated as pink eye. And some people, when they're getting pus coming out of their eye, they call that pink eye. Again, those are all kinds of pink eye because your eye is pink and inflamed. But again, when there's mucus coming out of it, it most likely is infectious and bacterial. If it's itchy and watery, it's more likely to be allergic. These are just large generalizations. But there are more serious types of pink eye. For example, ones that persist despite your pediatrician giving you some simple treatments. There can be things that go deeper into the eye and are not just a simple pink eye and require further evaluation and care. So I think the misconception about it is that it's a very sort of simple and one disorder, and everyone should realize there's many subtypes of pink eye that really require primarily your pediatrician, followed by either a pediatric ophthalmologist or pediatric optometrist for diagnosis. Treatment options for pink eye, again, depend very much on what subtype of pink eye you're dealing with. But when you're a concerned parent at home and you simply have your child waking up with their eyes irritated and pink, it is important first to sort of think about what the history is, what happened. You may want to think about whether the child was exposed to another child or daycare with pink eye, in which case you're going to assume it's infectious. And the treatment options typically are suggested by your pediatrician, like simple antibiotic drop for a few days, eye drop for a few days. Some of the things you can do at home right off the bat when the eyes are irritated, things that are across the board harmless, are buying some artificial tears over the counter, natural tears refresh, and putting in some of those just to soothe things. Also, cool compresses like either a washcloth or a cool towel against the eye can be very helpful. And keeping the eyes and surrounding tissue clean, washing the hands of the child, and really keeping your distance until you know what, whether this is an infectious pink eye or an allergic pink eye or a different variety of pink eye. Um, Monitoring the child for signs of fever, sore throat, ear infection. The majority of pink eyes are dealt with by your pediatrician or primary care provider, family practitioner, because they see the large majority of pink eye, which is infectious. But anytime it persists after these simple treatment methods beyond 5 to 7 days and is not improving, then certainly it becomes the role of an ophthalmologist, a pediatric ophthalmologist, or a pediatric optometrist to really evaluate and make sure it's not a more serious concern. So, to reduce the risk of infectious pink eye, that can be difficult, especially with very young children, younger than 6, because as you know, they like to touch their friends, touch the toys, touch things in school, and touch their face and eyes. I think some simple measures are just basic hygiene, like getting our kids to do more hand washing, which a lot of daycares have gotten better at. And when a child is bathed at night, I think a lot of us who've raised our kids, you wash the hair, you wash the body, you wash the hands, but most of us don't wash the eyes. Nobody wants water or soap in their eye, but it's not a bad idea to, with a gentle washcloth, perhaps mixed with dilute baby shampoo, to do an occasional gentle hygiene around the eyes, particularly if you have a young child who's starting to develop some mucus or some redness around the eye, just to clean the area very gently. But sometimes pink eye cannot be avoided, just like any bacteria or certainly any virus. And the key is to try to protect the child from, prevent the child from infecting other children, infecting the school, the daycare, or even, the parents at home. Our practice, University Children's Eye Center, is centered around children and all of their eye care needs. We are primarily focused on a lot of the medical issues that children can have, including pink eye, particularly something that may look like a pink eye but might be a more serious sight-threatening situation. But we also have 2 pediatric optometrists who will see particularly the older children for issues like pink eye or routine eye examinations. Children's eyes are not like adult eyes, and certainly they need their own special attention, and they have different diagnoses. And this is what our expertise is in the eyes of children and overall eye health, both preventative as well as taking care of active serious issues.